With me now is Walton County Sheriff Michael Adkinson, South Walton Fire District Chief Ryan Crawford. Guys, we've actually had some breaking news in the last few minutes. Can you guys talk about maybe just for a second what's going on with Seaside?
Yeah, thank you, first of all, Chief Crawford, for joining us from South Walton Fire District. Seaside, as we understand, just recently sent out an email saying that they're scaling back some activities, including closing commercial stuff starting Saturday, and it looks like it's going to extend through most of April as well. And some of the specifics are going to be out on Seaside's website. I know Chief Crawford and I will both try and share that information as well. But it looks like what they're going to do is close the commercial businesses and close their beach accesses as well.
Okay, and what kind of impacts will the sheriff's office sort of feel from that? Is there anything that you guys will be doing or enforcing as that goes along?
Well, I mean, I think bigger than Seaside, our job is to mitigate the risk both to the public and to the first responders, be that the Walton County Fire Rescue north of the Bay or South Walton Fire District. And Chief Crawford and his staff were here meeting with us today and talking about how to limit exposure with our first responders, what we need to be doing, how can we work together and to keep the public informed, as well as, again, keeping our workforce healthy, which I know, Chief Crawford, is an issue for us both.
So how are you going to do that? How are you going to keep your guys healthy and keep them protected and keep them safe in this time?
Well, yeah, I want to touch on one thing, and I'm going to turn it over to Chief Crawford. But the main thing is for us to identify those cases where we come in contact and we know that there is a positive or presumptive test for COVID. And so we've got some protocols that our fire personnel here, both at Walton County Fire Rescue and South Walton Fire District, have. But Chief, I'll let you talk about that a little bit and explain, what we're doing to try and protect our employees.
Thanks, Sheriff. That's correct. We're trying to collaborate as best we can between our public safety agencies here in our county, sharing best practices. We want to make sure that we have the appropriate personal protective equipment, whether that be N95 masks, gloves, surgical gowns, and so forth. The CDC recommended personal protective equipment. We've already completed just-in-time training with all of our folks, so they're readily prepared to don that equipment appropriately and to provide care for our community as those needs arise. The sheriff briefly spoke about we were using a surveillance tool as well through our 911 dispatch, where we ask certain questions to try to identify those individuals, if you will, that would meet that criteria to be considered a patient under investigation, so that we can reasonably notify our responding personnel prior to them getting to the scene to wear that personal protective equipment before they make contact with that patient, so they're as best protected as possible.
And I think one of the things, Chief, that we've decided both in North Walton and South Walton Fire District is that we want to limit the number of ambulances that come in direct exposure. So we're trying to set up specific response crews to try and, again, reduce the total number of people potentially infected at any one time. That's just good best practices, and that's something we both fundamentally agree on.
Okay, absolutely. There's a lot of fear, quite frankly. I imagine that you guys are dealing with that. What's the sort of the calls you're getting at 911, and what are you telling folks when they call and they're concerned that they might have this or that they've been exposed in some way?
Well, I think first, and again, I'll let Chief Crawford elaborate on this, but we don't want you calling 911. We do not want you, unless you're an imminent threat to your safety, we do not want you calling 911 to get information or to say that you think you may have COVID. That is a normal routine call. You need to go ahead and place that normally and not tie up 911. I think the biggest thing is this idea of the unknown. I mean, there's a problem balancing getting this information out. There's a lot of fear mongering going on. But quite frankly, there's a lot of people that are not taking this as seriously as they should. So, there's the balance between being diligent and being, run around like the sky is falling. And so a lot of our calls are things that sometimes don't make sense, like, lock the roads down, don't let anybody in. Well, that doesn't make any sense. That's not prudent, right? The other side of that is let's have a, 2,000 person house party. That doesn't make any sense either. So somewhere in the middle, using good common sense procedures, I think is really where we're coming down, Chief. I don't know what you guys have been hearing as well.
No, I would agree, and I think the message is if folks they genuinely feel like that they may have this virus, and the message should be that they should contact their county health department or contact their physician ahead of time before going into a facility and get direction from that point.
But for sure, not one.
Okay. So again, not calling 911, doing, and we've heard that from the health department and from other places, that they want people to call their doctor, they want people to call the health department directly, and again, not to spread the virus. That's the whole point of this. That's the whole point of all these lockdowns, and is not to spread it. In Walton County, we're talking about protecting first responders, healthcare workers. Do you guys have enough equipment, the things that you need to sort of make sure you guys are protected?
Yeah, I can answer for my agency. Yeah, we do have the appropriate equipment, and we're working with our state partners through the Department of Emergency Management to place additional orders for supplies. But we are in a good place right now to protect our men and women.
Okay. For sure, and likewise here at Walton County Fire Rescue and the Sheriff's Office side of it, law enforcement operations. I will say this, and I think it's an important thing to remember. I heard this analogy used the other day. I like it, and I think it's appropriate. We have to stop thinking about this as being a blizzard. Something that happens one time, a couple of days is bad, and start thinking of it as a winter. There's going to be really, really cold days. There's going to be days that are warmer than others, and it's going to be ebbs and flows over the next 6 months to a year. And really, that's the mentality we need to get into, is a long-term attrition to dealing with this, and not think this is going to be over in 2 weeks, because quite frankly, it's not.
Yeah, and that's something we're all coming to grips with, I think, as these shutdowns sort of happened. President Trump was just talking, and they're asking people to limit groups to 10 people or less. Well, if you go to a restaurant, there's more than 10 people in most restaurants. So a lot of us have to sort of rethink what life and society is going to be like. You guys are employers, and you have folks who are sick. You have to deal with that. What are you telling your employees these days about social distancing, coming into work when you're sick, those kinds of issues?
Well, I think Chief Crawford and I both, just got out of a meeting a little while ago, and the reality of it is we don't want employees to come to work when they're sick. Because that's just going to compound it. And it's going to be critically important for us to follow our own protocols to try and limit this. But unfortunately, first responders are who are going to get hit first and hardest. The staff that you see sitting in front of us from our offices, we're going to carry a higher infection rate. That is the reality of the business we're in. Our job as administrators is to the best of our ability to limit that impact through good protocols. Chief, am I accurately?
Yes, sir. That spot on, Sheriff. I totally agree. And everybody obviously is concerned about this. I think it's important to keep in perspective that this pandemic is the first pandemic that any of us have ever experienced in our lifetime.
Right.
We are writing the book on best practices on what the public health response is to this. And so I think here in Walton County we have a good team of professionals that are we're making solid planning assumptions and making sure that we have our associated equipment and we have our respective employees prepared for what may face us here in the coming weeks.
The other sort of issue that I bet you guys are dealing with is sort of rumors, rumor mongering. Can you lay any sort of concerns you keep hearing? The latest I have is basically no one in Walton County, Bay County, any place like that currently is confirmed for COVID-19. So can you talk about that at all, and about rumors in general and what you guys are seeing and what you guys are responding to?
So I'll address that first and just say simply this. Let's be clear about this. There are going to be COVID cases here. This is not a conspiracy theory, nor is it an overreaction. It is a pragmatic, scientific fact. You are going to have cases confirmed here sooner rather than later. We know that. We're planning for that. We're moving forward, and we're doing the best we can to give information. It's very difficult if your opinion on this is dictated by political ideology, right? If you think this is a liberal conspiracy, or you think it's a secret Chinese espionage project, either one of those are wrong. Sorry, that's just the facts. The reality of it is that does not help the situation. What it needs is pragmatic, professional, scientific based policy, best practices and procedure. And that's what we're trying to give you, is getting out of all that other stuff and not biting into the fear mongering, not biting into any of that political ideologies, but being what the public expects us to be, and that's professional. Chief.
I completely agree, Sheriff.
All right. Tell me a little bit about the jail situation. There have been some places where they have, maybe they're not bringing in lower level cases into the jail, or maybe they're releasing folks from the jail. You know, you have to keep your jail workers safe as well, and while they're dealing with inmates. So what's going on there?
So, interesting, Walton County Jail is primarily already mostly online visitation. So this is something we were a little bit ahead of as far as in dealing with. We really did it for contraband interdiction several years ago, but most of our jail visits are actually video or online. So, at this point, that doesn't really present an infection risk from a visitation standpoint. It does, however, present a pretty serious problem from us from a standpoint of people coming in and out of jail. We've been very good in working with the judiciary, has been very good in working with us about making sure that we're able to mitigate and manage inmate population based on risk. If that becomes an issue, we'll deal with that. But, quite frankly, our screening is a priority for us, so that we make sure that we don't introduce anyone into the facility that we have a reason to believe. You have to understand, we talked about no confirmed cases in Walton County. At this point, I think we're waiting 6 and 7 days on tested, so we just have to work on the presumption of who has this as far as bringing them into the jail. Quite frankly, that's no different than we dealt with things like tuberculosis, right? The issue here is the large number of people that are going to be exposed. So yes, it's critically important for us to the best of our ability, to keep those cases out of jail, and or those that are too serious not to handle in another manner, that we keep them isolated in the jail. But that is a very difficult proposition. And the state of Florida has recently suspended transporting Department of Correction commitments to them. So we're currently, anybody that's sentenced to prison who would normally be sent to a prison are now currently being held for at least the next 30 days in the local facility. So that's going to get to be an issue here.
All right, fair enough. What's the situation in stores in Walton County in terms of people sort of hoarding things or maybe fighting with each other over things? Are you guys seeing any problems there?
Well, I'll have to defer to you, Sheriff, on the fighting, but I think it's probably similar to other areas. We're seeing we have the transitional nature of tourists coming in town, and typically the weekends are very busy times in our grocery stores, and you're seeing the same surge that you're seeing in other counties where supplies are being taken in larger order than typical, if you will. And we've been reassured by our state officials that there's no real issue with our grocery supplies, that they're going to be there. So there's really no need for that. We should really be considering our neighbors and others so that everybody has the same opportunity to purchase those supplies, and there's really no reason to buy all those products in fear because they're not going to be available.
Yeah, there's kind of a limit how many cases of tap water you need. How many cases of bottled water you need, right? Because the water's still running and it's fine. There's still, as fast as these folks are going in there and hoarding it and buying it up, guess what? The delivery truck's coming in the next week and it's delivering and filling back up. So there's going to be a limit to when somebody starts looking around and say, how many cases of tuna do I really need in my house before they figure out the food trucks are still coming every week?
Yeah, you hope so. We go around and we look and we get a little concerned. But hopefully this idea of I got to buy everything up in the store will mitigate.
Yeah. Sure.
Tell me what else you want the public to sort of know as we go forward.
From my standpoint, I would think probably the most important thing, again, is that I want you to get in this mindset, this is not over in 2 weeks. There's already a level of frustration, both internally and externally, with what's going on, and so people they want somebody to lash out at when things it's confusing and it's unknown. I understand that, but I would ask them to remember that this is going to be an extended period of time, and just what you see here. These are your public safety professionals this is what we do. We do our best to serve the public, but we're communicating and we're working together and we're on the same page in what we're trying to do. And so I'd take heart in that. I mean, this is, our fire rescue personnel, all across the deputies, your detention deputies, your dispatchers, they're your animal control, your folks are still going out and they're still doing their job, and they're doing it understanding that they've put themselves at risk when other people don't. And that's what you expect from us.
Thank you guys very much. I really appreciate you being here and kind of informing the public on what's going on. And we're gonna say thanks for now and move on.
Thank you.
Really appreciate you.
Thank you, sir.
Thank you.
Okay. We're gonna wrap this up now, and I want to thank you guys for being here. And as we go on, we'll have more of this and let you know what's going on with the public.